I just finished my ACLS course, Advanced Cardiac Life Support course, which I take every other year as part of my requirement to have a surgery center on site. And I was really impressed with the instructor, Robert TWITE, who for the first time actually got me excited about CPR, basic life support, and advanced cardiac life support. He was just a really good educator, so much so that I felt compelled to pass that information on to you, the viewer. Even though this is not really much to do with plastic surgery, I think this is a good video log on just trying to understand what you need to know as an individual out there trying to save a life. We're not going to really focus on advanced cardiac life support. We're going to focus on basic life support. And one thing that Robert emphasized really importantly is that advanced is not some kind of notion that someone's superior to basic life support provider, but actually the basic life support is the only thing that has been shown to increase the survival rate in individuals who have been stricken with a heart attack or whatever it may be that have caused them to fall down. Now, what are the two important things in basic life support in order to save a life? They're going to be, one, CPR, high quality CPR, not just CPR, but high quality CPR. We're going to talk about that, and also some of the new thinking, which I think is quite profound today, as well as the placement of an AED, or automatic electronic defibrillator, which is something you really should have on site. We're going to talk about that as well. This is not a substitute for a basic life support course. I really encourage all of you out there to take one. The changes in the instructions and the way that they really present this information since 2005 has been quite dramatic. So let's talk first about what high quality CPR is all about. First of all, it's immediate. When you get to the scene, besides getting some help and getting the ambulance coming, the ambulance is not going to save the individual's life. You are going to save the person's life. It's the first 3 to 5 minutes that's absolutely critical. If you can imagine, if you don't have oxygenation to the brain for the first 5, 6, 7 minutes, it really doesn't matter what happens thereafter. So that first few minutes is absolutely critical what you do. Now, a lot of people get stricken by fear. They go, oh my God, what if I don't do the right thing? What if I hurt this person? But what Robert talks about is, you know what? I mean, you can't get more dead than dead. You can't. You have to save a life. You really don't have any options there when someone's in front of you and they're falling down. Now, in the old thinking, you had to check for pulse. You had to check the airway 100 times. And he was questioning, what does even checking the airway mean? The key with this is actually starting to save a life. So what does that entail? Very deep, high pressure CPR compressions after you've already made the initial evaluation, given a couple rescue breaths. The thing that's really interesting, there's been a trend in the last few months to talk about something called hands-only CPR. And what this is essentially is that they found that individuals that get just chest compressions actually have as good a survival, or could have as good a survival, as those that had both the mouth-to-mouth as well as the chest compressions. Now, why is that? Some of the thinking behind this is that the oxygenation, the nutrients in your body are already there, and when you're blowing air into the person's mouth, you're really not delivering very high oxygenation. You're just blowing in air. It's already been recycled through your body, so you're not delivering that high quality oxygen anyways. All you really need to do is get that blood circulated around, which is going to be so very important, because the person's already subjected to room air. The other fear is that if you overventilate and you're sitting there just constantly blowing air in, you're going to actually create too much intrathoracic pressure, too much pressure in the lungs, so that when you are actually trying to create good chest compressions, you're not delivering that. So even if you're afraid of mouth-to-mouth, even if you're afraid of germs or of diseases or whatever it is, and you see someone falling down, the two critical things is high intensity. You can't do it too deep almost. You want to do it deep and fast. Hard and fast chest compressions, and getting that defibrillator present as fast as possible. And shocking someone is actually something that is life-saving, because in adults, one of the most common causes of death is ventricular fibrillation, or VFib, where the heart is just a bag of worms just vibrating. And an AED is is really brainless. It's not something where you see in ER, the show where they have two paddles and you've got to actually do something intelligently. You get the device, you take off the pads, make sure there's not a hair on the chest, and get the two pads placed on. They actually tell you exactly how to apply them. First thing, you turn on the AED, and you need to stop CPR when those pads are on, because the key is get this person shocked early. And hopefully most places have an AED. If you have a place of business, I have an AED here. I check it every day. Make sure you buy an AED. It's absolutely worth getting one of these. It's going to be a lifesaver. So the AED is really what's going to save an individual, as well as early, rapid, hard chest compressions to save an individual, even if you don't give breaths, which is very, 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 very important. And it will actually tell you how to put it on when you look at the pads, the AED, and it'll also tell you when you hit the button whether to shock the patient or not. It'll say shock indicated or shock not indicated, stand clear, and you stand clear, and it'll actually help shock. Now, the other thing that's so important with this is that when you're giving chest compressions, the idea is, well, what if the person has a pulse? Am I going to damage this individual? Actually, what's really interesting is what Robert was explaining, and I thought was very fascinating, is that CPR, the chest compressions, won't hurt someone except if that person will just have some bruising or some soreness from the chest. But if you don't give it, that person is going to die. And oftentimes what happens is, if you're not a health professional, is that if you check the pulse, you could be wrong. And so the joke he was saying is that if you check and you go, I don't know if there's a pulse, and then someone came and you say, well, let me ask Susan here, she's over here, why don't you check this one? Well, I think there's a pulse, and then you have to get a tiebreaker. A third person comes and says, does that person have a pulse? Don't worry so much if the person has a pulse. If the person is not responding, begin CPR. Obviously, you can check for the pulse, but this should not take more than a couple seconds. If there's any question the person doesn't have a pulse, you need to begin CPR, because chest compressions that are rapid and fast are going to be what's going to save this person's life. It is not the fact that, oh, I'm going to hurt this person if I'm beginning CPR. As Robert says, if that person wakes up and tells you, hey, stop banging on my chest, that's going to be a good sign that you don't need to continue. So that's really, really important, is to really conceptualize those two things: AED to help shock the person if indicated, and CPR. So when you get to the scene and you've done the initial assessment and you've got 911 called, you've got someone in place to try to get the AED immediately to the scene if possible, and you begin initial quick evaluation, a couple quick rescue breaths, and you begin chest compressions, how do you cycle through this? What is the thing you should be doing at this point? Basically, what I've been instructed here is the new guideline is 30 compressions to 2 breaths. The breaths are good, but they're not the critical thing. The chest compression is a critical thing. And you're going to cycle through 2 minutes, which actually sounds like a long time. The AED, it will actually feel like a long time. The AED will actually tell you when to stop CPR, and for it to check the rhythm to see if it's a shockable rhythm, and then for you to start again. So until the ambulance gets there, if you know nothing else, chest compressions, rapid, hard, fast, and switch out with someone so you don't get too tired. And at 2 minutes, when the AED tells you shockable or not shockable, and let's say it says shockable and you've given the shock, and should you continue CPR? Yes. So there's oftentimes after a shock, and even if the person goes back into a rhythm, there probably is very poor perfusion, and you need to continue the CPR. If it says non-shockable rhythm, you need to continue the CPR. You need to continue the compressions. The breaths that we just hinted at a little bit are going to be over about a second time, and they're going to be over a window of about every 6 seconds or so if you're not dealing with an advanced, like an intubation type of situation, or a breathing tube, and you're just breathing. The other thing is really important too, I think it was emphasized, was interesting, is we get so caught up on the ideas that we have to have, a tube or a certain instrument to help breathing. They've actually found that the tube can be dislodged or displaced, and you may be even doing more damage to the individual than just breaths through a bag mask or through mouth to mouth. So it's very important that you just think about it. Even if you don't want to give mouth to mouth, you think you're not doing any good for the individual, you really are. Rapid, fast chest compressions until the AED gets there and tells you stop, and let's analyze it again. Get the AED there as fast as possible, and then cycle through and continue to do it until you get the ambulance on site and until someone tells you to stop. So these are just some basic ideas. I certainly, again, really want to emphasize that the words that I've said are not meant to convey that you should be certified in CPR without a formal course. I really encourage you to do two things. Get certified in CPR. Get certified in CPR. Number two is get an AED somewhere in your office if you have a place of business. Those are the two things that I could highly recommend for you to have done, and not to use these little words of wisdom that I've imparted to you as some kind of gospel, but at least as a starting point. And at least if you do come to a scene where someone is injured, you can help someone, and hopefully someone saved a life from this short video.